Hello, my name is Brandon, and I am addressing my topic of discussion, which is assisted suicide or euthanasia, mainly in the United States. However, I will touch briefly on the increasing popularity of this procedure in other parts of the world to show correspondence on how it relates to the United States. Especially the Netherlands, because that is where it has been legal the longest, so there have been the most cases there. So we can take a lot of information from those patients, the history leading up to them requesting the procedure, what kinds of competencies people have, where they're at with their state of mind when they request these things, certain things like that, that can provide us insight that can be directly related over to the United States. I didn't know much about this topic beforehand. I did know that it was legal in other parts of the world, but not the United States. However, it is legal in quite a few states. Mainly Oregon and Vermont is where we shift our attention to. Those states have had it legal since the 90s. And in both states, taken directly from their health websites with statistics, show only increasing popularities for these procedures, which can indicate and does indicate a widespread acceptance of these procedures and a level of understanding on how these procedures work. So basically, what euthanasia is, or physician-assisted suicide, otherwise referred to. Basically, it is a legal prescription written by a physician for a legal dose of medications that basically just puts you to sleep and is very painless. It takes a matter of 10 or 15 minutes, and it is requested by the patients. However, in some instances, it is requested by family members due to patient's lack of competency, or whether they're in a coma, certain elements like that would leave it into the hands of other caretakers. It is a very relevant situation. It has been enacted as recently. It's actually going to be enacted in California in mid-2016. So it is very relevant, and it is very much indeed an ongoing process. And records only indicate in the places that it is legal that there is definitely more people who request this and achieve this procedure. And once again, that definitely indicates that there is a higher level of acceptance, more and more every year, of people who agree with this procedure, as do I. A lot of patients in these situations, they really wouldn't request this sort of procedure unless they weighed out all of their other options and determined that this was the best bet for them. So my statistics are derived directly from the health websites for these for the states, Oregon and Vermont, directly from their health websites. I did look into some articles written by Citizens Concerned for Life. They are an organization that is against legal euthanasia, and a lot of these websites, especially Citizens Concerns for Life, only offer viewpoints that are basically strictly opinionated. The main argument that I was seeing throughout the boards are that the act of legal euthanasia in and of itself is going against what the true nature of pursuing a job in the medical field is, and that is to preserve life and encourage health. However, a lot of these physicians, I'm sure, are looking at this situation as a method of a way that they are helping these patients, because the patients definitely feel as though they need this is the final option for them, and they request it. So overall, increasing popularity is happening all over the world. Statistics definitely show that, and in the places where it is legal, there is not too much hold up to argue against it, especially, you know, for terminally ill patients who have explored all of their options. So overall, widespread acceptance. Oh, okay. Overall, widespread acceptance is definitely being shown, and a lot of people agree with active euthanasia, as do I.